Tēnā koutou katoa. Welcome to eHealthTALK NZ. I'm Rebecca Macbeth. I'm the media editor at HINZ. I'd like to thank Virtual Medical Solutions for sponsoring this podcast episode, where I'm joined by Director Adam Benko and Health Through the Marae Chief Executive Perry Minhinnick. Welcome on the show, Adam and Perry. Great to have you join me. Perry, can you start us off by telling our listeners about your marae-based health initiative, how you use telehealth and remote patient monitoring to reconnect whānau and healthcare services?
Kia ora kōrua, Atamari, and thank you for the invitation and the intro. For us to understand our existence is to understand how we got here. And, we've been delivering services for 40 years now, and Health Through the Marae was one of many initiatives that were created by my brother who had passed away in 2016. As a young fella, 17 in fact, he kind of was on a mission to improve Māori health. In 79, he initiates this marae health, and then the vision being that marae health is fundamental to Māori health. There are currently 23 whareoranga around the motu today. From within our whareoranga, we provide a range of services, including nurse-led clinic, the nurse-led virtual GP service, rongoa Māori services, and a whole range of services actually that over the years we've adapted to meet the needs of the whānau that we serve. Home visits have become the most valuable tool in our kete and helps us to understand whānau needs and priorities, but also it helps us to align our limited resources to where they're needed the most. Yeah, it's kind of exciting. That part is allowing us to be creative in our thinking. But these home visits, we identified that whānau had disconnected themselves from mainstream service, in particular GPs. They were telling us that they were not being heard or not being listened to, and then they just didn't want to engage anymore, and they did exactly that. The home visits told us a lot. That if we weren't doing that, we probably wouldn't have known. We set to provide whānau with medical devices that help them to take readings and monitor themselves at home. And we supported them with training. All the meanwhile, we're trying to look for a long-term solution. And we opened a virtual GP service. And then we met with Virtual Medical Solutions, who provide us with the TytoCare.
And where are you based exactly?
So we're based out in Waiuku at Tahuna Marae, in Waiuku, south of Auckland. So as rural as you can get.
Great. Well, thank you, Perry, for that introduction. And what about your background, Adam? Tell us about Virtual Medical Solutions.
Yeah, kia ora, Rebecca and Perry. Lovely to talk with you guys today. Virtual Medical Solutions was established to be the New Zealand partner for the virtual medical platform TytoCare. So my background is doctor recruitment, and that was actually, if we look at Health Through the Marae, that was the first service I was supporting them with, providing them with the GPs to support them virtually. And the opportunity came about for us to take on the distributor agreement for TytoCare for New Zealand. We saw that as a different avenue to be able to bring real, true value to New Zealand's healthcare providers. As a recruiter, that's something which is very difficult to do because the need is so great. There is a huge shortage, as everyone knows, of doctors across the board, across specialties, across areas, rural, urban. It's really difficult to help everyone as a recruiter. But we did see the increase and the acceptance, people's attitude shift towards virtual and telehealth, which, it really is happening right now. And TytoCare is really at the forefront of taking that to the next stage. So moving from recruitment, we've gone into supporting providers with the technology aspect. And we use a lot of the experience from recruitment around workforce attraction, workforce retention, and trying to support the providers to build sustainable services that offer continuity to the patients.
Yeah, so interesting, and something you hear a lot about, that journey of perhaps a doctor on a one-to-one basis providing care, but then seeing digital enablement as really increasing their capacity to provide for a community in that way, and just have that greater impact. So Health Through the Marae and Virtual Medical Solutions, you've built a long-term partnership, obviously. What does make that partnership different from that traditional tech provider arrangement from your point of view?
I think it's a holistic partnership, it's rooted in shared values, respect, and a commitment to collective well-being. So I think that's what sets it apart from the conventional tech provider dynamic, I suppose. But our commitment and trust and belief at the beginning, because for a long-term solution to, first of all, meet the needs of those people who needed it most. And it was our shared conviction, I reckon, that the belief in the tools was going to make this difference and bridge that gap, And I guess for the both of us, we were taking a leap of faith here in what we were doing with this, because they were new at this and we were looking for a response. But yeah, it was our faith in the technology, just revolutionary, really, to be honest,
Yeah, I'd add to that the people. Piri and her team have a clear primary focus, and that is the whānau and the community, and what's best for them. So they've always been driven to just get things done and not get too tied down in the kind of politics of healthcare. And when we look at the actual people doing the mahi, Bex, the on-site nurse, Gillian and Angela, the doctors, like these are people that have bought into that as well. And it's a real privilege to call them a partner, to work with them. And Piri has helped me massively in developing the values of virtual medical solutions as well, I'd say. We started the business because we saw that this tech was something that we should have in New Zealand and patients should have access to. Every New Zealander should have access to this because it does bring so much value. But as a business and where virtual medical solutions is actually going, I think a lot of what we've discovered about supporting and working alongside providers, being on their journey and working things out together. A lot of that has come from the relationship that I've built with Piri and her team.
So how would you say that the sort of the values of your two organisations do align? And sounds like that was really critical to making this work long term.
We were both committed to, what the outcome was going to be. We had already used the Tyto devices in the past. We had them in the homes of our whānau, but on a trial basis. So we knew that they were going to work and that they were an awesome solution for what we were faced with at that time. And so I think there was a commitment from both of us to ensure that this was going to happen.
If we look at what we're trying to achieve with the TytoCare, it's access to a trusted healthcare provider, and that's something that we're growing, we're building on. And if we look to the future, I'd say are aligned in a clear vision of what this technology is going to look like in the future, which is going to be more access, more patients having this technology in their homes, having it in different community centres, in different clinics, in different marae, schools, wherever, to connect through to the providers and for the community in Waiuku to understand that we don't just have to come to a clinic, we don't just have to go somewhere to receive healthcare, we can receive it from wherever, and we can be more in control of what we're doing. And that's something I think when we talk about aligning our values, I think we also have a vision that's aligned with this, and I am fully committed to helping Piri and the team to deliver on that.
That trust is so critical in healthcare, isn't it? Especially with communities who may have disengaged from traditional providers. I think it's fair to say that most healthcare providers, or many perhaps, they might start with their technology and then sort of try to build a model of care around that. But at Health Through the Marae, you've taken the opposite approach. You started with the community need. Piri, can you just talk about how that process works?
I think, it's kind of embedded in our model of care, a part of the concept of Health Through the Marae and whareoranga, so building capabilities to strengthen whānau individual capability that in turn builds whānau capability, and then even contributors to iwi and hapu capabilities. And for us, it's always been about that, building the capability of whānau so you can ultimately be the resource. And so putting all these things in place first, and then technology just complements that, I guess. It's complemented the relationships that have already been built rather than replacing that. And you need to understand what the priorities are for whānau. So if you go and get the tech and then you try and put it in front of somebody as a solution, that, you might not get the response because we've already built the relationship, we've supported building those capabilities and understanding what their needs are, priorities are, makes all the difference. You work on that first, and then technology complements that.
There's an element of not overcommitting as well, right? You saw TytoCare and, you were willing to give it a go. But you got the community buy-in as well, Piri. Did you want to talk about that?
Yeah, absolutely. I mean, the model of care is whānau first. You get buy-in because you get to understand if you're going around to seeing these whānau every day, you get to know them on a different level, and so there's a huge trust built right there. But it's not just the whānau we serve, but the community, like the schools, wherever there's people that require support, then that's where we are. So listening is the next most valuable tool, because if you're not listening, then you can't be as effective in your support. And house visits and home visits that we do, we learn so much from them. And when you can support whānau in that way, then, they trust that whatever you're putting in front of them is good for them or is best for them, because it's been years of build-up of trust, for whānau who have been shit on, I suppose, to be honest, in mainstream systems, systems they don't want to access anymore. So, and the kind of going back to the concept is that's what it's all about. Because it's not just technology, but we create programs designed specifically for those needs, and often that means they're programs that don't exist today. So finding solutions and being creative is fun, because whānau have an input into that. So we don't create something and then hope they show up. No, well, here's an idea. We go back around again and say, if we were to do this, what do you think? Would you participate? Yes or no tells us whether or not we're going to go ahead and do that. Same as with Tyto. We didn't just plonk it in there. Tyto just kind of brought all those things together and just elevated the experience. Because whānau talk about it all the time, about having their own autonomy. They're sick to death of not being heard. So rather than disconnect, what is it that you want? I want to take care of my health. I want to understand actually what's wrong with me. I want to understand the pills I'm taking. So I think the model of care is going around and sitting and listening and understanding. And when we say building capabilities, it's the whānau you serve or the whānau you work with, they become the resource. They really do. And if you look at our team today, all of those people are made up of whānau we've supported, who have become the resource. They're now being contributors. They're now being able to share their knowledge. So nothing's not achievable. It's just you have to build the relationship. You have to understand. You have to be genuine about your desire to want to help.
Focusing in on the technology itself, the Tyto remote patient monitoring devices allow people to do things like examine their own throat and ears and heart sounds. Can you just talk about how patients responded the first time they used the technology, generally your whānau response to it?
It didn't take long for whānau to learn how to use these devices. They're pretty user-friendly to begin with. The fact that you have your own whānau surrounding you in a support space. But we went out to a lot of places, not only homes, we went in hired halls, and we got people sitting in there so that 4 or 5 different whānaus collectively can sit there and teach each other how to use these things. So everyone was really excited about using Tyto. My moko, for instance, he had bad ears, so all these years he had been going to a doctor, not knowing what they're doing, just poking and prodding, not being able to see what's going on, not being a part of the conversation, to today he can pick up the device, stick it in his ear, turn his phone on and know, when it's starting to go red, it's an onset of infection, So he knows that now and actually was using it since he was 3. So I think this tool is the perfect tool to get into the homes, so people can start monitoring and doing these things, on their own. And that was what was exciting for whānau as well, is being able to monitor yourself at home. Everybody in the whare knows how to use the tool, seeing someone come on screen and they've been so used to face all this time. So the fact that you're able to conduct this consultation yourself. That's part of the whānau capability building as well, is you run that consult, you go there and you be the driver. So all these things were really exciting for whānau to be able to do something they've never thought was even possible before this.
But what about the doctors, Adam? How have they responded to it?
Yeah, I mean, look, what TytoCare is bringing to the doctor's side of things is clinical grade exams. So, traditional telehealth of a phone call or even a video call, you'll hear of services using that. Maybe it could be a patient in a clinic, and you might have some support of a nurse or another clinician that can describe things over that consult, or it might just be a telephone consult where it's just between you and the patient, and you're trying to hear what the patient is describing to you, and then you've got to guess. But what TytoCare removes is that guesswork. It's giving you actual exams to base your diagnosis on. And I think listening to what the doctor's feedback is, they love that it works. Like, the technology is designed to be used autonomously by the patient. So it is very simple in its design. The actual hardware device of TytoCare, the TytoCare device plus its 3 attachments, there's no cables. It's really easy to attach the attachments. It's just a push in and a pull out. The user interface in the app and in the clinician dashboard is really simple. There's not too many buttons, and it's just a case of following the steps. So yeah, they love that it's simple. They love that it works. And that it's allowing them to do so much more for their patients remotely. And this is just kind of the tip of the iceberg with TytoCare, because so in New Zealand, we don't actually have all of the features, all of the AI features, but the future of this technology is bringing in AI lung sound suites, which, that is identifying ronchi, crackles, wheezes to the clinician. So this is going to support them even further once we bring and have those AI features approved. There's only going to be more benefits to this platform, and in allowing the clinicians to do their job safely. That's the biggest thing. It's about safe medicine and, top of scope. One other thing just to add is when you're looking at the images on the screen and you're listening to the stethoscope exams, they are as good as, and often better than, in person. So the ear exam, it's a bigger image. It's not through a tiny little otoscope. I had a very experienced internal medicine specialist tell me the other day that the stethoscope, the digital stethoscope on TytoCare, is the best he's heard from any product, and he's tested many of these digital stethoscopes on the market. So it really is excellent quality.
I know you initially thought Kaumātua might struggle with the tech, Piri, but I understand they've become your strongest users. Why do you think that is?
Yeah, I think it's all part of that, being able to see what's happening live, and then you've got the doctor on the other end who's working through with you. What that's about. I think that's made a huge difference too. Because Kaumātua have always been a face-to-face kind of people. It's not like them in their nature to sit back and have this kind of conversation, but it's not just a one-way kind of conversation. It's a conversation that they've had to be a part of. They've had to and want to too. So that they've never had that before. They've sat there and just listened to whatever they've been told in the past, and so they were used to that. 40, 50, 60, 70 years of face-to-face one-way conversations. So this one here, they're truly a part of it, and the fact that they can see what's going on with them as well. So awesome educational tool.
Yeah, sounds really empowering for them. It's interesting, saying most people sort of are used to face-to-face care. Adam, I guess if you had to get over that idea that telehealth or virtual care is a lesser than the traditional face-to-face, and how do you talk about clinically safe virtual care and what that means in practice and how these devices and technology enable that?
Yeah, absolutely. And there's a lot of truth in what some clinicians say about current telehealth. The fact that it can be unsafe. If you're practicing telehealth, in traditional forms, typically you're going to be very risk adverse. If you can't be sure, you're going to then arrange for that patient to be seen in person, which is creating double ups. And if you're a paid for service, a private service, and that patient's just called you and paid $70, $80, and you've not been able to help them, and then they've got to go then to an urgent care and pay again, or even go and wait in an ED, it's just not a very convenient service, and it's limited for the patient. So what we're talking about here is reducing that double up appointment, and by having those clinical grade exams at your fingertips, being able to be more assured in your diagnosis and in your decision making as a clinician using virtual technology. That's what we're doing here. And I think we're at a point now in New Zealand, we are behind the rest of the world in this. There's been this shift in the last, I'd say, 12, 24 months that's been growing and growing and growing. People are becoming more trusting of this sort of technology. But, at first, I'm not expecting you to trust it without trying it. So it is a case of, look, just giving it a go. And if it doesn't work for you, at least you've tried it. I think what's most frustrating is when you've got providers that just don't want to give it a go themselves. They'd rather see what other people do first. But yeah, it's just about giving it a go, and you'll see that this really does work. You're talking about hundreds of thousands of TytoCare devices being used worldwide. They're in 32 other countries currently across the world, America, Canada, NHS, Australia, Europe, South America, Asia, like literally spread across the world. So we are slow to the adoption, but I think now there's never been a more accepting time for this technology and for the clinicians to give it a go and see for themselves.
And as you've explained, Perry, that traditional model hasn't worked for large portions of the community as well. So interesting that people remain wedded to something that ultimately is not actually delivering for some of our more vulnerable rural communities. I believe you're now working on a pilot in a school-based innovation. Is that right? Can you tell us more about that?
Yeah, we've partnered with a nurse lecturer, senior nurse lecturer and researcher, Dr. Sarah Williams at AUT. And Sarah comes from a background of school-based nursing. So I reached out to Sarah after I've seen her thesis online, which talked about, a different way of delivering school-based nursing services. It oversees TytoCare is in schools. It's being used to provide a virtual nursing service to the schools. So I was looking for someone to run with this in New Zealand, and I came across Sarah. Now, through Through the Marae, I was aware that they had a really close relationship with their local primary school, and that they were supporting them with needs of children that were unwell through no contractual agreement, nothing formal in place. It was just because it's the right thing to do for the community. Everyone knows everyone. So when hearing this, it was like, this could be the perfect place for us to look at trialing and piloting and seeing if we can build this. Yeah, excitingly, we're pretty much at the end of all the kind of funding applications. We've got ethics approval, and we should be seeing the pilot starting in term 2 this year. And then off the back of that, we're hoping to go for a HCC funding and take it further. So in its simplest form, essentially, the title will be at the school, supported by Through the Marae, and we're going to link the school to the nurses and see if we can make a much more accessible and convenient service for everyone involved.
I'll certainly be interested to hear more about that for eHealth News as well. And finally, Perry, for other providers wondering sort of where do I start with virtual care, they're interested, what advice would you give about choosing the right solution and the right partner in this space?
For us, virtual health has significantly improved the lives of the whānau we serve, and the technology with Tyto, has just revolutionised their accessibility for us. In terms of relationships, whānau have been through a lot, so we are very kind of protective in that sense around the relationships we kind of get ourselves into to support whānau needs. But I mean, our experience in terms of virtual health has been nothing but exceptional, to be honest, and there's nothing but value in it, and more value to come.
Look, most providers out there are trying virtual or telehealth in some form or another, and quite often what I hear is we don't have a need. Our patients don't want that. And often they see it as us trying to maybe replace the in-person, which is what we're definitely not trying to do that. This is a service which, as I said earlier on, it offers stability and continuity when workforce issues arise. And, you've got a small clinic in rural New Zealand that for decades has always had high staff turnover, and every year, or if they're lucky, maybe every 2 years, they're having to recruit again. And every time they're recruiting, it's costing them lots of money, and the patients are having to re-engage, build that trust with the new doctor. And it's just, it's not a sustainable way to do it. Whereas what we've got is, in virtual health, you've got the opportunity to build a New Zealand-based workforce, or even New Zealand trained or registered doctors that are based overseas. But you can reach more doctors. You're not asking them to relocate. You're just asking them to give you some time. Many GPs are working 6 sessions a week and less. So even if they can give us a session or 2, you can build a sustainable team offering that continuity. And virtual enables that. And TytoCare is about doing this properly, not just, piecing together a bit of a service to give it a go. TytoCare is it's already built. It's off the shelf. The platform is there, the video conferencing technology, the workflow is built into it. It's really simple to set up, and the device, as we've already talked about, is very easy to use. So it's just a case of, if you want to do this, commit to it and do it properly. Do it clinically safe and get the best results from it. That's essentially what we're trying to deliver.
Thank you so much for your time there. It's great to hear a digital health success story. So keen to hear about how it develops, and especially how the school pilot goes. Thanks to both Adam and Piri. Thanks to Virtual Medical Solutions for sponsoring the podcast episode. And to our listeners, be sure to like and subscribe to make eHealthTalk easier for others to find. Mā te wā.